children grow up, they blossom into adults. And this takes a little bit of time, During this time, they suffer, unfortunately, because they are in this wonderful world. So they suffer. They suffer from diseases, from different problems as they grow up. So we as parents are faced with our children suffering. They suffer from fever, cough, cold, vomiting, loose motions, and whatnot. Most of them become better with or without medicines, with or without treatment. But the interesting thing, and the most, I would say the most important things that parents need to know is, when do you really consider your child to be seriously unwell? In other words, we are talking about the recognition of a sick child. And there are certain things which parents must know, and that I'll be discussing them in quite a few, in a couple of interviews. And we will be talking predominantly of the symptoms that the children have, the signs that they exhibit, and where are the danger signs. We must identify the danger signs. They are very important to the management of the child. Say, for example, the child has a fever. A fever is a very common thing. It's a symptom. I've spoken about this before as well. But what happens if the fever is hectic, if it's very high, 104, 105 degrees, when the child is unwell with a severe headache, vomiting with the fever, not behaving normally? Those are the times that we should get worried. And as parents, we must understand when to see a doctor. So if a child has got fever, the first thing we essentially need to do is to definitely cool the child down. So give antipyretics, make sure that the child has a sponge, cool the room temperature, less clothing, and plenty of fluids. But if the child becomes significantly unwell, the child becomes drowsy, lethargic, not in his normal self, the smiles have vanished, this is the time when you need to really get in touch with a doctor. If the child behaves abnormally, there's increasing drowsiness. The child vomits incessantly. The child becomes lethargic, and the child is not able to keep down any fluids, vomiting quite a lot. There are loose motions, plenty of loose motions going through, and you can't even halt it. The child is not having food at all. And whatever the child is having is vomiting. The child is very listless and not responsive the way that he or she should be. Is not smiling, is not talking back, very quiet, rising from the bed with a lot of effort, or if not rising at all. These are the times that you need to be careful about. The child may be going into shock. If the child has got abnormal movements, then possibly the child is going into fits, and that is very crucial. Remember, a lot of children, about 20% of them have febrile fits or febrile seizures, as we say. And the most important reason that happens is because it's very unique to this population between 6 months to 5 years. At the height of temperature, within 24 hours of fever, when they just lose their consciousness, preceded by jerky, interrupted movements of the different parts of their body. It's very important that you identify this and treat it accordingly. And how do you treat it? The first and the most important thing is to cool the body down. And how do you do it? So you strip the child, make sure that the child has, plenty of cold water sponged all over the body, put the fans on, the AC needs to be on, and the medicines to put down the temperature should be given on a regular basis. So this is one small example. There are other conditions also. Say, for example, if a child is having fever, quite a lot of fever, and the child suddenly starts developing a rash. Rashes come and go, and all rashes are not measles, mind you. So they can be different sorts of rashes. They can present on the face, they can go over the body. Measles is only one of the very many viral diseases that causes rash. But if a rash is very rapidly spreading, if the rash doesn't blanch on pressure, so if you put pressure on it, the rash doesn't go off, then possibly it's sinister, it's bad. If this rash is associated with the child being significantly unwell, as I've told you before, or if with the rash there's bleeds, the bleeding starts from the mouth, from the gums, from the vomits, from the stools, from the urine, then once again you are heading for trouble. And these are the conditions associated with the fever you need to be very careful about. The reduction of food and especially fluids is of imperative importance, and we need to concentrate on that, because a child needs to keep on having fluids as much as possible. If the child suddenly stops drinking, and starts vomiting or passing loose stools, we have to be very careful. And a very good indication of the child getting dehydrated is the reduction of the urine output. So if the urine goes down, the child becomes very listless, and you cannot keep fluids down. I don't mind if the child is passing 15 loose stools, as long as the child is cheerful and happy. But if the child becomes listless, even after passing 2 big stools, large stools, 2 large vomits, that would be sinister, and you need to call for help. I will be discussing more of this in a subsequent lecture. But thank you so much.